Today I am going to tell you about blood group testing. This is RBC, red blood cells. This is about ABO system of blood group typing. There are other various types of blood group typing, ABO and RS system. In this is an RBC. Usually RBC is non-nucleated. This is biconcave. On surface there are some antigens, and in blood serum or plasma there are antibodies. These attack foreign RBCs, means which are not there in their body, and hence this helps in determining blood group. So there are in ABO system there are mainly 4 types of blood group: A, B, AB and O. Then in RH system there is positive and negative. So we are using antibody to detect antigen present on RBC. So in A type blood group, antigen is A and antibody is B. AB is antibody. In B blood group, antigen is B, antibody is anti-A. In AB blood group people, AB is the antigen, there is no antibody. In O there is no antigen but there are anti-A, anti-B antibodies. These antibodies attack RBC. So in AB patients, people with AB blood group, there are no antibodies, so they can take blood from A, B and O because there are no antibody to react. So they are universal recipient, they can take blood from all. This is O. In O there are no antigen but antibodies are there in blood, so they cannot take blood from others, they have to take from O, but they can give blood to A, B, AB and O. So they are called universal donor, that is they can give blood to any of the 4, A, B, AB, O. Then RH positive or negative based on RH antibodies. Again in RBCs there are RH antigen, just like AB antigen there are RH antigen. In RH positive patient there are RH reactive antibodies. In negative patient with negative RH, there are no antibodies, but if they are exposed to antigen they may develop antibodies. So blood group can be A positive, A negative, B positive, B negative, AB positive, AB negative, O positive, O negative. So A blood group has to take blood from A, or he can take from O because there is no antigen. Person with B blood group, he has to take blood from B or O, as O is universal donor. AB, he is not having an antibody, so he can take blood from A, B, AB and O. Ideally O has to take from O only because he is universal donor, but he has to receive from O only. Why we should know blood group? Blood group knowledge helps in avoiding ABO incompatibility, and in pregnant patient RH incompatibility helps in rhesus factor diseases. So in laboratory we use antibodies against antigen to detect blood group. So this blue color is anti-A antibody. Red color is yellow color is anti-B. This white is anti-D. So if blood clots with A, means anti-A antibody. Of blood group testing. This is anti-A monoclonal antibody. If the blood reacts with this and doesn't react with anti-B but reacts with combined, means the A antigen is being attacked by these antibodies. So the interpretation is blood group A. Then if it is not reactive to anti-A and it is reactive to anti-B, then reactive to both combined antibodies, then it is B, because anti-B are acting against B antigen. If it is showing clotting with A, then clotting with B and combined positive, means both antigens are present at surface of the RBC, so blood group is AB. If there is no reaction to anti-A, means blue color, anti-B and combined, then there is no antigen on the surface of RBC, so the interpretation of blood test is O. Then next is Rh positive or negative. In Rh positive or negative, if it reacts to anti-D, it is positive, Rh positive. If it doesn't react to Rh anti-D, then it is Rh negative. 3 drops of blood. Blue color anti-A. Yellow color is anti-B. This red color is anti-D, that is Rh negative. Mix the sample. We use EDTA samples for doing blood group, as there is anticoagulant. If plain is used, already the RBCs might be clotted. Use different sticks to mix. ಇದರ ಕ್ಲಾಟ್ ಆಗೈತೆ, ಇದರ ಕ್ಲಾಟ್ ಆಗೈತೆ, ಇದರ ಕ್ಲಾಟ್ ಆಗಿಲ್ಲ. ಅಳಗಡ್ಸಿ ನೋಡ್ಬೇಕು. ಇದಕ್ಕೆ ಅಂತಾರೆ ಇದು ಬಿ ಪಾಸಿಟಿವ್. ಯಾಕಂತಂದ್ರೆ ಯೆಲ್ಲೋ ಕಲರ್ ಆ್ಯಂಟಿ-ಬಿ RBC ಮೇಲೆ ಬಿ ಆ್ಯಂಟಿಜನ್ ಇತ್ತು, ಅದ್ರ ಮೇಲೆ ಆ್ಯಕ್ಟ್ ಆಯ್ತು. ಅದಕ್ಕೆ ಬಿ ಬ್ಲಡ್ ಗ್ರೂಪ್. ಬಿ ಬ್ಲಡ್ ಗ್ರೂಪ್ ಒಳಗೆ ಆ್ಯಂಟಿಜನ್ ಬಿ ಇರ್ತೈತಿ, ಆ್ಯಂಟಿಬಾಡಿ ಎ ಇರ್ತೈತಿ. ಸೊ ಎ ಬ್ಲಡ್ ಗ್ರೂಪ್ ಇದ್ರಾಗ ರಿಯಾಕ್ಟ್ ಆಗಿಲ್ಲ, ಆ್ಯಂಟಿ-ಎ. ಸೊ ಇದು ಏನು ಬಿ ಬ್ಲಡ್ ಗ್ರೂಪ್. ಬಿ ಬ್ಲಡ್ ಗ್ರೂಪ್ ಆ್ಯಂಟಿ-ಬಿ ಆ್ಯಂಟಿಬಾಡಿ ಇದ್ರ ಮೇಲೆ ಆ್ಯಕ್ಟ್ ಆಗಿ ಕ್ಲಾಟ್ ಆಯ್ತು. ನೆಕ್ಸ್ಟ್ ಇದು RH ಒಳಗೆ ಇದು ಓ ಅಲ್ಲಿದೆ. RH ಒಳಗೆ ಇದು ಆ್ಯಂಟಿ-ಡಿ ಹಾಕಿತ್ತು, ಅಂದ್ರೆ RH ಇದ್ದು. ಸೊ ಆರ್ ಬಿ ಸಿ ಮೇಲೆ ಇದಿತ್ತು ಅಂತಾರೆ RH ಆಂಟಿಜನ್ ಇತ್ತು, ಅದಕ್ಕೆ ಆಂಟಿ ಡಿ ಆ್ಯಕ್ಟ್ ಆಗಿ ಕ್ಲಾಟ್ ಆಯ್ತು, ಗಂಟು ಅನ್ಸಾಯ್ತಲ್ಲ ಏನಂತ ಅದಕ್ಕೆ ಕನ್ನಡದಾಗ ಏನಂತಾರೆ ಅದಕ್ಕೆ ಇದು ಬಿ ಪಾಸಿಟಿವ್. Interpretation of blood group testing: if blue color, yellow, and this is RH, they are mislabeled as O, this is RH. If reacts with clumps are formed with blue, not with yellow, and with anti-D, it is A positive. If it forms with A, B, and not with this, then it is not reacted A negative. Not reacts with A, reacts with B, and reacts with anti-D, it is B positive. Doesn't react with A and anti-D, it is B negative. If it doesn't react with anti-A, anti-B, but reacts with anti-D, then it is O positive. If it doesn't react with any of the three, it is O negative. If it reacts with anti-A, anti-B, and anti-D, means antigen, all three antigens are present on the surface of the RBCs, it is AB positive. If it acts with anti-A, anti-B, and doesn't react with RH negative, it is AB negative.